Good afternoon. I am Dr. Chetna. Today we are going to talk about the benefits of minimal access surgery. So, minimal access surgery is more commonly known as keyhole surgery or a laparoscopic surgery. Now, this is a revolution in the medical science, which is now we are practicing for last 15-20 years, and it has given excellent results. A lot of people still in tier 2 cities or otherwise in metro cities also still have fear about laparoscopic surgeries. When they come to OPD, they start talking that, the surgery remains incomplete and stuff. Now, here I would like to bust this myth and explain to you why a minimal access surgery is far superior to an open convention surgery. Now, a minimal access surgery or a laparoscopic surgery is done through making punctures in the abdominal wall. Now, this can be used for various diseases like to remove the uterus, to remove the ovarian cyst, to correct the polycystic ovaries, to remove endometriosis, to correct ectopic pregnancy, and other fertility related surgeries. So, we can remove large fibroids as large as 7 months pregnancy size to large ovarian cyst. Yes, there are certain prerequisites which we need to see before we decide whether this patient is fit for laparoscopic surgery or not. Majority of the women who are otherwise fit, that means they have a normal exercise endurance and stuff, are able to withstand minimal access surgery. So I was coming to advantages. So advantage number one is there are no major cuts on the tummy. So there are some small punctures. They may vary in number between 2 to 4 or sometimes very rarely 5. And the size of these punctures, the largest would be about 10 or 12 millimeter. So you can believe that these are very small punctures. The second advantage is the surgeon is operating under the magnification of 6x or more. So that gives a lot of access to the pelvis, so we can see it very properly. If required, we can just rotate the camera and go in the upper abdomen and see that as well. So there's a lot of benefit when it comes to the visual appearance of the organs and the operation skill. Then the instruments that we use in laparoscopic surgeries are very fine. To explain, my scissor blade is not longer than the nib of the pen that you use, not the ink pen. We're talking the regular gel pen. So that is the size of the blade that we use. So that gives a very fine precision. Then the blood loss is quite less. So, and since the abdomen is not open to the air outside, so the recovery of the patient is very fast. That means the less number of hospital days of stay, less chances of blood transfusion or almost no chances of blood transfusion. You can go home fast. I have had patients who did the surgery, second day they went to work, fifth day you see them coming from the office to remove their stitches. So this is brilliant. So, and you can't expect. So very next day the patient sits and starts eating, talking, and everything feels very normal. So it is a blessing, it is a boon. And since majority of the surgeries can be done by laparoscopy, I would say before going in for open surgery, every candidate should be considered for laparoscopy. There could be some cases where certain candidates are not fit for laparoscopy and these can have an open surgery. But majority of the patients who have had fibroids, ovarian endometriosis, ovarian cyst, polycystic ovaries, pelvic infections, ovarian mass, some of the cancer patients also, uterus removal for heavy bleeding. So all these things can be done through a laparoscope. So I believe this is a blessing by this modern science and we should all avail of this benefit. So if any questions, you can always meet me up at Miracles Mediclinic, Sector 14, and also part of Apollo Cradle Hospital. So you're welcome. Thank you.